the human aspect of oncology. I think that you form a very special relationship and bond with your patients that you're not going to get in many other areas of medicine. You're really seeing them when they're at their most vulnerable and very scared, and you're helping them through that and guiding them through that. I think it's fascinating. I think that when I was in medical school and training, oncology was just on the verge of exploding, which it has in the last 10 to 20 years. We have a great array of new drugs, and I very quickly understood that to be successful in oncology, you had to have a great understanding of these diseases right down to the cellular level, to the molecular level. We need to understand the DNA and the genetics behind cancer and what happens within the cells so that we're able to very specifically target our treatments to those abnormalities. And that's exactly what's happened. The treatments have become more targeted, they're therefore more effective, and also a lot less toxic with less side effects because of that. Our understanding of some of the genetic, inherited genetic mutations that predispose individuals to these cancers has also come a tremendous way in the last few years. We're able to test for these genetic mutations. For the patients themselves, we can sometimes tailor the therapy specifically to those genetic mutations. I still consider myself relatively young. I don't think I've been doing this for that long, and I'm just amazed at the transformation that's occurred in terms of our treatments for so many of these cancers compared to when I started doing this to now. The regimens in many diseases have been completely revolutionized. We're not using those cytotoxic chemotherapies anymore that are causing the typical side effects people think of, like hair loss and nausea and vomiting, and we're using drugs that, like I say, are more effective, less toxic, and with better results. It's like I say, it's it's wonderful, I think, to form those relationships with patients. Many of them, I consider friends, and many of them have told me they consider me a friend rather than a doctor. We don't just talk about their cancer and their treatment. We talk about their lives and their families and good things and bad things that are happening to them. And that's the part I probably really enjoy about my days.